Hi, this is Dr. Pelto. I want to go over the 2015 bunion treatment process here for our office. So if you're dealing with a bunion and you want to know what the best way to treat it is, this is a typical bunion, the different types that we have, and this kind of goes over how you can be treating it, just so you're well informed when you're meeting with your doctor. So let's get started. Everyone wants to know what causes a bunion. Usually it's from parents or family, or sometimes it can be a mechanical instability of the foot with the tendons pulling harder on one side versus the other. It tends to get worse over time and many times can be affected by a poor shoe choice. And it doesn't really matter what caused it. It's more important how you're going to treat it, or if you're going to treat it. The bunion treatment process usually involves evaluating the bunion, reducing the inflammation, reducing irritation, correcting heel alignment to help prevent joint jamming, and then surgery is the last option. So let's really start with evaluating a bunion. You want to evaluate someone walking and standing. So not just x-rays, not just looking at it in a chair, but walking and standing, you can see how the lay of the toes are, of the bunion itself. So the bunion is really this bump on the side of the big toe joint, and we tend to measure this angle between the first and second metatarsals, and you want to close down that angle. That's the whole goal, so you're not having that big bump on the side. So this is an example before and after of a bunion surgery. Initially, before surgery, though, we try to reduce the inflammation, so you can use ice, you can use an anti-inflammatory medication or a cream, rest. Most people try those things before they come and see us. Wider shoes to reduce inflammation, and then a cortisone injection is usually what we do right in this bursal area. This is a little sac of fluid that can sometimes develop over the bunion that kind of makes the skin stick out. Other times there can be pain in the joint, and cortisone can be used inside the joint. Another thing we want to do is reduce the inflammation and irritation in there. To reduce the irritation, you want to reduce the rubbing on the shoe. So padding and spacers are going to be used. So here's a pad on the big toe joint. Here are some spacers between the toes and a spacer right here as well. Correct toes can typically be used as well in this area. And these are some types of shoes that really work, that are extra wide to reduce the irritation. You want to correct the heel alignment, and that's to reduce the joint jamming. These can be done with supportive shoes like we talked about before that are extra wide. There are some new minimalist shoes that work really well. Orthotics sometimes can help as well. Doing something called a first ray cutout, this can help the joint have more movement, and so it's not going to be jamming as much in the joint. But these are, once again, all temporary things. They're not going to correct the underlying problem. They're just going to make it more comfortable for you. If surgery is needed, you have to discuss with your doctor what type of surgery you want and really is beneficial to you. For a smaller type of a bunion, we tend to remove just the bone on the side and then shift it over and put a pin in there or a screw, and that's called an Austin bunionectomy. This is the most common bunionectomy that we do in our office. The recovery is about 6 to 8 weeks in a walking boot. It's a relatively common procedure. If you have a little bit larger of a bunion, a scarf bunionectomy, this is called a mid-shaft bunionectomy. The more that the bone is open here, the further back you have to do the work, because that allows you to swing the bone over a lot more without cutting the bone as much. You can only shift it so much if you do the cut up here. If you do it down the side like the scarf bunionectomy, it's a little bit, you get a better shift. And even better than that is a lapidus or a closing base wedge bunionectomy. But the problem with these is that you have to be off your foot longer. But once again, for a bigger bone deformity or something that moves a lot back here, it's better to do something back here because it's easier to shift it over. And sometimes you need to do that with another procedure. Here you can see they had another procedure called a Weil osteotomy. So these are some helpful things for you. I want to show you some other resources. If you go to worcesterfootcare.com/bunion, you go to this site, and it's going to take you to this handout, this bunion handout that I have online. So you can see part of it right here, and I just want to show you. Here's the bunion information. This is the bunion treatment process that I use in the office. You can look at that. Here's a bunion handout, and here's some before and after x-rays for bunions, and here's really how you're going to stay off your foot after surgery. There's a few good techniques, information about a lapidus bunion, and correct toe information. And here's a couple of shoe stores that I refer to in Massachusetts. So this is some other information that you can look at if you go to that website. Hope you found this helpful.